Let us go to etiology in Chinese medicine. Introduction. The human body is an organic whole. At the same time, there is an intimate relationship between the human body and its environment. This relationship is one of dynamic balance, opposition, and unity between the internal environment of the body and its external environment. It is by maintenance of this dynamic balance that the body's vital activities are assured. Should this dynamic balance be disturbed for any reason and the body unable to restore it spontaneously, illness can result. The factors that lead to such disturbances are the cause of illnesses. There are many causes of illnesses in CM. Examples include unusual climatic conditions, contagious pestilence, inappropriate diet, fatigue or exhaustion, passion, traumatic injury, and injury by animals and insects. In order to comprehend the nature and pathogenic characteristics of these causes, ancient physicians made a number of attempts to classify them. The internal classic was the first to classify causes of illness by yin and yang. Thus, the plain question states, disease-causing or pathogenic evils are born of either yin or yang. Those born of yang derive from wind, rain, cold, or heat. Those born of yin derive from inappropriate drink and food or improper living accommodations. Joy and rage are also yin and yang, or yang. The Han Dynasty physician Zhang Zongjing pointed out in the Essentials from the Golden Chest that there were three mechanisms for illness to develop. The 1,000 illnesses can all be subsumed in three groups. The first group comprises interior illnesses caused by external evils attacking the meridians and invading the Zangfu viscera. The second group comprises exterior illnesses caused by blockage of meridians, hence blood stasis in the forelimbs and 9 orifices. The third group comprises injuries caused by intemperate sexual activity and wounds from weapons, animals, and insects. All causes are accounted for by this classification. The Song Dynasty physician Shen Wu advocated the theory of three causes, namely external causes by invasion by the climatic pathogenic evils, the internal causes is injury by the passions, and causes that are neither external nor internal, like inappropriate diet, exhaustion, trauma, animal, and insects. These classificatory attempts by the ancients to combine pathogenic factors and the causes of illnesses are highly significant in clinical diagnostics. In CM, there is no illness that does not have a cause. Every illness reflects the body's response to its causative factor and its actions. In the course of any illness, cause and effect interact, so that what may be an effect at one phase may in another be a cause. Phlegm accumulation and blood stasis, for example, are effects of dysfunction of qi and blood of the Zangfu viscera, yet they can induce certain pathological changes. In addition to understanding the nature and properties of the causes of illness, the study of etiology is mainly the attempt to determine the natural course of illness on the basis of clinical manifestations. This approach is known in CM as seeking the cause through syndrome analysis. Thus, the study of etiology in CM attends not only to the nature and pathogenic characteristics of the causes of illness, but also the clinical manifestations they induce. In this way, it provides the basis and guide for treatment and herbal prescription. Thank you so much for your attention.